Hey guys, I hope you're having a fantastic day. Thank you so much for joining me. I'm going to the ER now. I'm not sure if I had a heart attack. I want to kind of get checked at this point. The chest pain's been pretty severe and intense with a lot of pressure off and on since Saturday. Sorry, gotta get meds in too, right? So if you're a spoonie and you haven't yet, go take your meds. You're welcome. So yeah, we're going to just get checked. I have a lot of abdominal pain as well. I also have a migraine, a lot of pressure in my head. I am not really certain what's going on. I really can't make as much heads or tails out of what's going on. I usually have more insight and kind of, okay, like this is the direction. And I hate when I don't have direction, because at this point sometimes they look at me and they're like, well, what do you think right now? I don't know what's going on. It's kind of scary, because everybody's scared. So I feel like now, you know what, I have a right to be scared. My doctors are scared. I'm not like freaking out, but like it's nerve-wracking, you know, like when you think of it. It's like, okay, like what is wrong here? And then it's really like, I think my thing is scary for me is kind of them coming back and going, everything looks good, and you're like, I feel like I was hit by a bus. So yeah, that's where we're at the moment. I'm pretty dizzy too. The blood pressure, I was getting really funky readings, and I know like a few times my cuff was reading it wrong. So I got like 60/90. Come on, it's not real. Okay, so I'm not going to do a full update, but we found some stuff. It is a little bit concerning. We're not certain if I did have a heart attack, so when I get home and settled, either later or tomorrow, I will do a full update. Things have been extremely hectic since getting to the ER, and I was not able to obviously do any sort of update, which obviously happens sometimes because, you know, the main thing is to get everything taken care of and updates when we can. So hey guys, so I made it home. So super happy about that. Praise God. It was a super close call. I made it out like by the skin of my teeth. I really thought that they were going to end up admitting me. I'll get into that in a little bit, especially based off of all this. I've taken about half of my medication for the night. However, I already went into another Theo attack. I have a lot of adrenaline coursing through my veins at the moment. Been like a little bit shaky and stuff from it. Kind of really awake right now, which is great super late at night after a super long ER trip. Definitely not ideal, but we're gonna work with it. And I figured, hey, let's put this adrenaline to good use. You know what I mean? Since I'm up and awake and you never know what tomorrow will bring. So I wanted to do the update while I can. So I guess things got worse, I would say, like late Saturday, to be honest. I probably should have went to the hospital Saturday, but I decided to wait it out. I've already said this multiple times. It's really hard to make these type of decisions for me. And sometimes I definitely stay home when I could go, but I also feel like I'm just such a frequent flyer that I try not to overgo. So with all that being said, I probably waited a smidge too long, but I did go, and you know, that's the main thing, right? So the symptoms have been, I have had, like I told you guys, all this mouth stuff going on. The inflammation has not gone down enough. It went down finally this morning, like a smidge, but it's still not to the point that I'm like, oh, we're good. Not at all. So with that being said, we also had a lot of chest pain and really bad pressure in the chest that was going down both arms. I was having also jawbone pain on both sides, but then I'm like, okay, are you telling me this is like heart attack, or is this like infection? So like, as you guys know, so many things going on in my body, it is hard for me to tell at times. Sometimes I really know what's up, what's going on, and able to articulate everything. And then other times I'm like, what are you doing? Today was one of those, what are you doing type of days. So it was the chest pain. I've had really bad migraines, which nothing has been touching them. Finally, the pain meds at the hospital did, but nothing. I took my own pain meds, and I've taken Imitrex. There we go. I know this stuff. Long day. Anyways, and also a lot of pressure in my head, which I don't usually get this type of pressure with my migraines. It was a different pressure. My appetite had decreased. The pain on my right side came back again. And then I'm also having really, really, really excruciating kidney pain. It ramped up really, really bad to the point that I've been like screaming off and on. It's lovely. And so, yeah, I really thought, I was like, okay, I don't know, like, did I have a heart attack? Am I having one type of a thing? Everything was just still getting worse yesterday. It like calmed down a little bit in the morning, and then as the day went on, like my symptoms just kept coming more and more intense, more frequently, and the pain was just so bad. Like once you're at tear level and screaming off and on, that's when you know it's bad. I also kind of felt like I was hit by a bus. And you know, the pain does get really intense with Theo attacks, so it's hard. Okay, like, is this just a Theo attack, or is it something that I need to kind of go take care of now? Because obviously I know with Theo, we're going to have to, you know, formulate a plan and kind of figure things out. Okay, so let me just try to jump into the trip, because it was a long trip, people. So, ER was super insanely busy. Communication in the beginning, super bad. Not good for a patient with Theo, by the way, because they really stressed me out, which was totally not helping my case. So I waited, I would say 30 minutes or so in the waiting room before getting my EKG. So they come, they do my EKG. She's like, oh, don't worry about it. You know, we're a little bit busy. You're going to go back soon. Not a problem. I don't usually wait even 30 minutes with chest pain at my ER. Usually chest pain, back, boom, no big deal. So they run the EKG. I'm sitting there, time's passing, you know, more and more and more time. Everybody else is going back, literally. Some guy comes in, and you know, I'm not trying to downplay people, but also at the same time, I'm 27, I think I'm having a heart attack. Like the pain in my chest, I'm trying not to scream, you know, because I want to be respectful of everybody around me. Like, I'm not the only one in pain, obviously. But at the same time, like, I'm a little bit concerned, am I having a heart attack? This other guy comes, and he, like, cuts himself, and he needs a tetanus shot or something. Like, I don't know, maybe he called his doctor, and they were like, you need a tetanus shot. Like, go get that. Hands wrapped, little cut, on the phone with family, not a big deal, don't worry. Goes back before me. Then like other people come in, you know, like, oh, like little ache, little pain. Some lady even shows up and she's like, I was told to go to the ER, but I didn't call the doctor first, and I don't know why I'm here. She went back first too. So I'm like sitting there like, okay, do you guys not believe me? Did I like do something? Like, what in the world is up? So we're like getting to the point that, you know, it's been over an hour. At this point, we decide, okay, we're going to go ahead and contact my go-to person, my patient advocate, kind of let them know what's up and that we're concerned, because every time that we're going up and like my mom's asking like the people who check you in, I don't necessarily know like what their specific title is at the hospital, and she would be like, oh, could you tell me, is it going to be a long wait? Do you know what's up? Why is everybody else going in but her? And she's like, oh, we're just busy, don't worry about it, we'll get to her. And it was, I felt like, we both felt like they were just brushing me off. So I was like, oh my gosh. I'm like, oh gosh, like, don't tell me this is going to be a nightmare. You know what I mean? Like, if you're chronically ill, you know that sinking feeling. Like, okay, is somebody even going to listen? Is anybody going to believe me? Because I'm also having really bad pain again on my side and all of those classic symptoms of appendicitis. I did not think I had appendicitis, but at the same time, I'm like, I have the pain. You know, I want to be able to go to the ER and have an open dialect with somebody and just try to figure out what's up, because we're so complex. So finally a nurse comes over and triages me, and I'm like, what is up? Like, seriously, like, could you tell me, give me some insight? And she finally gave me some insight, and I was like starting to go, something more's up, but I wasn't really certain. And at the same time, I don't want to, I try not to like overly worry my mom. Like, I know I already do that, but I didn't want to like freak out and then like her go, oh, you know, freak out too. So I tried to remain calm, but the nurse told me then that I was critical. And I'm waiting for a bed in the most critical unit in the ER. Okay. So it's like, all right, well, usually with my chest pain, I score and I'm in the lowest, like, chest pain unit. I'm not really sure who designed these units, and I'm not really sure, neither is any of the staff, why they don't kind of sometimes throw the units to the side and take patients back, and then you all just got to do a little bit of running occasionally. I know it's not ideal, but at the same time, patients got to be seen, heart attacks, all that good stuff. But I think also it comes down to where the machines are for heart monitors. So it's this whole big thing. So finally, 2 hours later, I get back into a room, into a bed. So that was the big difficult part of the trip. Praise the Lord, because the rest of the trip was pretty good. It went really smoothly. I had a wonderful doctor. Some things I just wish she would have been a little bit more upfront, but I do feel like she hinted at the fact that there was a lot off with my labs, but was like, I'm not admitting you, but she didn't really like dive into it because she doesn't know what's wrong. And she did say, stuff is off, I don't know what's wrong. I would have just liked her to tell me like a bunch of stuff is off, but whatever. Like, not gonna nitpick at this point, you know what I mean? So it has been an interesting read, let me tell you. The rest of the trip was great. My nurse was wonderful. Absolutely loved her. We had a blast talking. I mean, she's funny. And gets my sense of humor, so that helps. Okay, so we're just gonna rattle it all off. I need to obviously talk to my team of doctors. At this point, obviously, I was not admitted. We decided for me to come home based off of COVID and how packed the hospital is, and because we don't want me to lose my spot for my PET scan. That, y'all, is like at the top of the to-do list. Like, if we were able to get in tomorrow, we would do that. Like, this. Okay, so like I said, the whites are elevated. Also, the red blood cells are borderline, and my platelets are high. And I'm sorry, I do need notes at this point because there's so much people going on that I can barely keep track. My kidneys are not functioning quite right. My liver, one enzyme is low, another enzyme is a little bit high. Trying to remember, like I said, I'm going to do it, you know, obviously quickly and as efficiently as possible. And then let me just more. Okay, so those are the labs that were run. A lot, like nothing super in depth or anything. My heart, they said the enzymes are normal. I don't have numbers, so I'm not super thrilled with that. I like, you know, tangible numbers just to see what's up, because that was elevated in the past. So next up is the CAT scan. They did see a stool in my belly again. Of course, that makes perfect sense when you have diarrhea. I mean, obviously. It's happened before. We don't necessarily know why. At this point, we've got, you know, bigger fish to fry type of a thing. My body does weird things. Excuse me. All I know, guys, is it's not really medication induced because my meds are staying like stable when it happens. It never happens when I'm changing like anything really, so that I'm aware of, because obviously you're not always scanned. They didn't say anything about my adrenal glands, and actually the hospital doctor was not thrilled about that. She was really upset. She also placed a call to them and tried to pull up the scan, but the system was being funny, so I'm waiting still to hear back on the adrenal glands. Glands, not sure which one it is at this point, but we will see. I'm trying to think if there's anything else on this CT. Oh goodness, guys, this is crazy. Alright, and the last thing, which is the thing that kind of makes everything come together and make sense for the beginning of my trip. And I was like, y'all, if somebody would have communicated this to me, it would have helped my anxiety so much, because I was, like I said, so concerned that I was not going to be taken serious whatsoever. But I already had a positive EKG and I had no idea. So I was like, oh, I guess my EKG came out normal and they're just going to tell me it's anxiety. That's kind of, what my train of thought was. My EKG, like I said, was not quite normal. So I'm sinus tachycardic right now, which is a certain type of tachycardia, like rhythm, I believe. That's like the best way I know how to explain it. They say possible left. I'm going to read. Okay, so they think that the left artery is enlarged. They also said that I had some dead tissue, but it's better than the last time they saw dead tissue in my chest. And they also have in there that they believe, it is hard to tell and confirm for certain, but they believe I did have a heart attack. I don't necessarily know when the heart attack happened. I have a suspicion that it could have been Saturday. But the way that it's written out, they also said that there's less dead tissue than December. So that makes me think, like, did I also have one maybe, like, around the holidays and I just didn't really realize? Or maybe with other chest pain recently. So I'm not entirely certain. But that's kind of where we're at. Those are all the updates I have. I'll let you all know once, obviously, I talk to my team and we kind of dissect a little bit of this more. Right now, currently, the pain is definitely still there. It's a little bit of an issue still. And like I said, I'm already going into a Theo attack, so I'm just hoping and praying at this point that I can sleep. Otherwise, it might be another long night. So with that, we are finding joy in the journey, and we will see you soon. Have an amazing evening. Bye, guys.